Basic life support, BLS. Basic life support is an emergency intervention, an assistance given by trained medical personnel, medical technician, or qualified bystander for life-threatening accident, sudden ailments, or casualty incident until further medical care arrives. There are two major causes of such emergencies. It's either heart attack or cardiac arrest. Now, for cardiac arrest, it is when the heart malfunctions and suddenly stops beating and pumping blood around your body, commonly because of a problem with electrical impulse or signals in your heart. When your heart stops pumping blood, your brain is starved of oxygen. This causes you to fall unconscious and stop breathing without warning. Heart attack, on the other hand, is when blood flow to the heart is blocked from reaching the heart, preventing blood from reaching the heart and other vital organs, as it showed. The signal for such interruption may have many of the following warnings: chest pains, tension, or hurting feelings in the center of the chest. Now, graphically, cardiac arrest is an electrical problem. The person will be unconscious. A heart attack is a circulation problem. The person will probably be conscious, but also in trouble. Now, to help revive such a victim in cardiac arrest or keep the person alive until medical help arrives requires CPR. And CPR stands for cardiopulmonary resuscitation. It is an emergency life-saving procedure involving chest compression combined with artificial ventilation, that's mouth-to-mouth breathing, to help the brain function again until natural or normal blood circulation is restored. Before you begin CPR, you need to assess the environmental situation to ensure the scene is safe for you and the victim. You cannot assist the victim if you are at risk yourself. So you look around, you need to look around for any hazard, electrical pole, snake, or any other hazard that could cause harm to you or the victim. Now you start CPR by calling out the person's name if you are familiar with the person. If not, just shout, "Hey," or "Hello, can you hear me? Are you all right?" Next, approach to check the victim for responsiveness by touch. If, where, and how you know how to check for pulse, do so. But because it has been determined that laypersons, rescuers, often are not able to reliably detect a pulse in a stressful situation, it's okay if you skip this procedure. So you could just simply put your ear very close to the person to feel whether the person is breathing, or by touch. If there's no response, call emergency service around your area or have someone make the call and fetch a defibrillator for you immediately while you start CPR. Now, CPR procedure, chest compression. Place the heel of one hand on the lower part of the center of the chest and the heel of the other on top, so they overlap. Then lock. Lock your elbow. Keep your arms at 90 degrees from the victim's chest. Now, compress the victim's chest at least 2 inches in depth. Do 30 compressions. Allow the victim's chest to completely recoil between compressions so the heart can fill with blood. Your beat should be fast, hard, about 100 per minute. Now for ventilation, resuscitation. Deliver 2 breaths each. Ventilation should be at least about 1 second in duration. Check to make sure the victim's chest moves. If not, you will need to reposition the head. Keep one, give 1 breath at 5 to 6 seconds interval. If there's more than 1 person around, you can perform the CPR or taking turns to avoid fatigue. Now, remember I mentioned defibrillator. That is AED machine. And what is it? AED machine is a life-saving device that can give your heart an electric shock when it has stopped in a cardiac arrest. AED is short for automated external defibrillator. An AED can be used on adult or child over 1 year old. Using an AED in crucial moment before an emergency personnel or ambulance arrive can increase someone's chance of survival. Anyone can use AED. You don't need to be worried about whether it will harm you or it will harm the victim, because the machine itself analyzes the situation, the victim's heart rhythm, and gives voice prompts as to exactly what to do step by step. Like I mentioned earlier, if someone has fallen suddenly, look around, call out. If there's no response, approach and feel for breath. If there's no breathing, ask someone to make an emergency call. If you're alone, you can make the call yourself so that the call is made and an AED machine is brought. But then you start the compression, that is CPR, immediately. Now, what are the steps with AED? You turn the defibrillator on by pressing the green button and follow its instructions. Peel off the sticky pads and attach them to the patient's or the victim's skin, one on each side of the chest, as shown in the picture on the defibrillator. Once the pads have been attached, stop CPR and don't touch the victim. The defibrillator will then check the patient's heart rhythm. The defibrillator will decide whether a shock is needed, is necessary. If so, it will tell you to press the shock button. An automatic defibrillator will shock the patient without further prompt. Please don't touch while this is being done. The defibrillator will tell you when the shock has been delivered and whether you need to continue CPR. When it says to continue with chest compression until the patient shows signs or the defibrillator tells you to stop so it can analyze the heart again. Anyone, like I mentioned earlier, can use a defibrillator. You do not need more than this basic procedural training that we do offer. Now I'll play a video of that same process, which gives more like a crash course on the use of AED. Like I mentioned earlier, so let me just go to the next one, which is breast examination. Breast checks can be self-examining. That's breast self-examination. It can be done by you or by a health personnel. It is an integral part of healthcare for everyone, particularly women in every stage of life. You can do so by yourself in the privacy of your home or with handheld device called breast eye, or you can go for mammogram, which is costly but necessary. But in addition to breast self-examination, whether you're doing it with your hand or you're doing it yourself, or you're doing it using your hand or the device, it is highly recommended that you get regular breast check or breast examination from your health care provider at least once annually, once you are over 40. Now, what are the breast self-examination steps? You need to be familiar with the typical characteristic of your breast tissue, I mean. No two persons' breasts are the same. Set aside a scheduled time for breast self-examination, either each morning, week, or month. If you're still menstruating, 2 to 3 days after your period ends is the best time, when your breasts are less tender and are likely to be less tender and swollen. Any day will do if you are through with menopause, either naturally or surgically. Now, what are the steps? You can stand, if you want to do it for virtual, stand in front of your mirror with your upper body unclothed and press both hands behind your head. Now, in front of the mirror, look for changes in the shape, color, and size of your breast. Check for skin dimples, pulling in of the nipple. Check for scaling or a rash on the nipple. Now, for physical examination, it involves 3 methods: using your hands, like I mentioned earlier, or having to go for mammogram center examination, or a simple handheld device, which is called breast eye. Now, the 3 methods for physical examination, either by yourself or by health personnel, are the circular method, the wheel-spoke method, or the grid. You can use the 3 middle fingers in circular process, beginning at the outermost part of the breast, and then circle round, pressing the flat portion of the 2nd, 3rd, and 4th fingers into your breast, moving in a circular motion slowly around your breast. You walk around it until you get to the nipple area. The wheel spoke, like the spoke of your bicycle wheel or car, or better still, the chopping of pizza into grid, what's it called again now? A wheel spoke, like I mentioned, method. Now, you begin at the outermost tip of the breast. Press the same flat portion of the fingers into your left breast. moving first towards the nipple, then away from the nipple. When you complete that section, slide your finger, slightly to the next area and repeat the same procedure or process. Then the grid method. With the same 3 fingers, parts of that 3 fingers, move down your breast firmly, press down on your breast firmly, and gently slide your finger up, then down, and so forth until entire breast area are examined. You can repeat the same for the other side. But like I mentioned earlier, your best bet is to have the breast eye device, which makes it easier because it just translates the light under the breast. Now, the picture, this is a picture that I'm being shown now, that of the breast, the one that is normal, and then the one that is that has issue. The one to the left shows normal. Now you have the light under the breast that brightens the place. If it once it's under, you can see through through the skin, the veins and all, like you will see underneath, just below the one that I just mentioned now, that is the normal. Is the light under darkness has just shown everything, showing the veins and the nipples or the areola. Now, the one to the right is the one that has issues, and then the light will bring it out. Now, if you look down further, you will see where the light has just shown an issue, a problem developing with the blood gathering. And then the one slightly to the right, before the picture of the device, is the one that already has an issue, which is clearly shown. I'll show, like I said, I will run a video of the AED, and then we'll have further talk. Thank you very much for your time. Now, the address of QuickSpace is up there. The website is there, the email is there, and some of our products, which includes, of course, the AED machine, the breast eye, and of course ABPM 50 that monitors blood pressure. My other colleague will be able to speak on the things I just shared. Thank you very much for your time again. Bye-bye.